Hello again everyone, Dr. Dan Bockmann. Today I want to share with you why our patients do what I tell them. And that may not seem like a big deal unless you are a doc in practice. And you realize it's not just chiropractic care, it's all of healthcare where patient compliance is called, is a huge issue. Meaning if an MD has a diabetic patient and they give them instructions on diet and exercise and the patient doesn't do it, I mean, their condition can rapidly worsen, and then they get zero benefit and actually worsen. And I mean, diabetes can lead to death. So there are huge incentives to do the things that we docs tell patients, but they very often don't. There's a host of reasons why not, by the way. I mean, it's just simply time. And we're all busy folks, and we have families and jobs. We have lots of other things competing for our attention. And not only that, but a lot of the rehab stuff, the tools that are going to end up ultimately being helpful to helping the patient get out of their pain, those don't always feel good to do, and they take time, and they're uncomfortable, and sometimes they're physically difficult or complex or confusing. So here is why we get such great compliance in my office with our patients, and I have to attribute it to trying to simplify the patient's problem down to its pure essence. So once the problem is understandable, meaning the patient gets why they hurt. They understand, oh, this back pain just doesn't randomly happen to people. There's a reason that I have my back pain today, and here are the two reasons, which I've talked about in other videos. But basically, it boils down to tight things and weak things in the huge majority of cases for all musculoskeletal complaints. See other videos for my explanation of that. Making rehab stupid simple. Follow it down in the feed to find that. But once they know, hey, there's just kind of two basic main reasons why we hurt, and I can check those things myself, the patient can check them themselves, and the patient can fix them themselves. And it also happens that I'm only giving them the most powerful tools to fix them at that moment, which is why I do not use e-stim, I do not use ultrasound, I do not use roller tables or heat or ice. Not that there's no place for those things, it's just that they're relatively weak treatment tools. Whereas foam rolling, massage, stretching, exercise, spinal manipulation, those are powerful tools. And they each have a specific job, which you'll see in that previous video as well. But if I pick the right tools and it has a powerful effect on the patient, then a couple of things happen. Number one, if the patient's doing them even once, they're almost certainly going to see some improvement in how they feel or function. That is the whole reason they came to see you in the first place, is because they hurt, they can't ignore their pain anymore, and they may be forced to do things differently in their day because it hurts too much to do them normally. That's when people will come. They'll put up with a certain amount of pain, but once they're being forced to stop playing golf, or pick up their kid, or drive to work, or sit at their desk, then it becomes much more, it moves up in their priority list. So if it's simple and easy to understand, and if the tools are powerful enough so that even if the patient does them once or twice, they see, wow, I feel kind of significantly better even after a day or so of doing these things, they'll be much more likely to continue doing these things because they see some immediate progress. As opposed to trying something for a month or two or three and just waiting to see if it's going to make a difference. Who's going to stick with that? No wonder people don't stick with long drawn out treatment plans that involve, really weak treatment tools that are poorly explained. So that's how you make patients do what you tell them, is make it clear so they know what's wrong and why it's wrong, how to identify the problem themselves, and I actually predict the outcome and the number of days it will take for them to get a certain amount of well. And when they see, oh, Dr. Bockmann was right, I'm like 80% better after 3 visits, then they're much more likely to continue doing that stuff in the future. So try that with your patients in your offices, or if you're just a regular person, try it yourself. And hope that's been helpful. If so, great. Give it a like or a share. And if you have a question you'd like me to answer on this forum, leave it as a comment in the section below. And until next time, I will see you guys.